Now I'm going to go over some post-operative instructions that are for the caregiver. After surgery, the number you will need to call if you have any questions or concerns, it's 770-407-0407. That's the only number you will need to call to contact a nurse if you have any post-operative questions or concerns. Call this number if you have any excessive bleeding, swelling, or pain that is not relieved by medication, any difficulty breathing, fever of 101 degrees Fahrenheit, or chills, which is usually a sign of infection, any foul smelling or unusual drainage, and if the patient is unable to urinate in 4 to 6 hours after surgery. If you're unable to get a timely response from the doctor and you have a life-threatening emergency, please call 911. For the first 24 to 48 hours, you or another adult must stay with the patient, and be sure to assist the patient with getting out of bed and moving about the house. Here's a list of medications the patient will be taking after surgery. They'll be having a stool softener, which is Colace, cyclobenzaprine, which is a muscle relaxer, ondansetron, which is for nausea and vomiting. They'll have an antibiotic, which will either be cephalexin or clindamycin. Also, they'll receive a pain medication, hydrocodone. And they're also going to be taking a Lovenox injection, 1 injection a day, for 7 days to prevent any blood clotting. For the dressings, keep the dressings as clean and dry as possible. Change them as needed. You can remove them if instructed to do so. Remove all outer dressings after 48 hours. Leave all steri-strips intact until instructed, or remove when falling off. It is important for the patient to keep compression stockings and garments on except when showering or washing the garments. Remove garments for 1 hour daily, starting the day after surgery. Patients with drains may not shower until the drains are removed, sponge baths only. They can take a shower 2 days after the drains are removed. Moving the patient after surgery. It is very important that the patient get up and move about the house every 2 hours starting the day of surgery. Remind the patient to wiggle their toes and roll their ankles while resting. The patient may start lymphatic drainage massage therapy the first day after surgery. Ice packs help reduce swelling, bruising, and pain. You can use frozen peas in the package, crushed ice cubes in a Ziploc bag, or frozen gel packs. Be sure to place a cloth or a towel between the patient and the cold packs. If the ice feels uncomfortable, do not use as often. Put ice on for intervals of 20 minutes on and 20 minutes off. For the patient's diet, some patients may feel post-operative nausea. Carbonated sodas and dry crackers may settle their stomach. If the patient is feeling well, you can give them liquids and soft foods, such as clear soup and Jell-O. If the patient feels fine with softer foods, you can progress to a normal diet. Encourage the patient to drink plenty of fluids like water, Gatorade, and/or juice, and get plenty of protein. Some patients may have drains, and depending on the type of drain they have, there's different instructions for them. Patients with bulb drains. The drain should be emptied when the bulb is half full. Remember to record the date, time, and the amount you emptied out of the bulb in the drain log that will be given to the patient during recovery. If the patient has a Penrose drain, the drain will flow freely into the dressing. Remember to keep the dressing dry and clean as possible. In regards to alcohol and tobacco, we advise that the patient does not smoke or drink alcohol while healing after surgery. Smoking reduces the capillary flow of blood to the skin. Alcohol enlarges the blood vessels and could increase post-operative bleeding. Please do not allow the patient to drink alcohol until they have stopped taking prescription pain medications, because the combination of pain medication and alcohol can be very dangerous. Your post-operative appointment is very important. Please do not miss it. And remember, the nurse line is 770-407-0407. Here are some recommended supplies you may need for the liposuction with fat grafting and also the abdominoplasty cases. You will need 1-inch silk or paper tape, peroxide, blue chucks or puppy pee pads, scissors, Neosporin or bacitracin ointment, gauze or thin maxi pads, a plastic mattress protector or chair cover. You can also use a shower curtain for that. Depends for the butt augmentation procedures, a boppy pillow also for the butt augmentation procedures, gloves, and a female urinal.